Our healthcare system, to me personally, sucks.
A lot of people feel that way. They say we have 45 million uninsured, millions more underinsured, healthcare costs spiraling out of control, and an increasingly obese and unhealthy population. They look at medicine in the United States and say, we're dead meat. So, if we are dead meat, what's the answer? Some people think we should emulate Canada, which has a government-run medical system that covers everyone. How well would that system work here? Before we can answer that, I guess we have to figure out how well Canada's system works for Canadians.
Canadians, you will find, are extremely proud of their health system.
Our identity as a nation is somehow symbiotic with this equality of healthcare.
Canadians long ago agreed that we would make a system work that would be there for every man, woman, and child, irregardless of their race, their financial ability to pay, and that has always been the end of that conversation.
It's free and fairly accessible.
I think that we're better off. Otherwise, you wouldn't be filming here.
Well, I'm quite proud of the healthcare system, and I've been a patient in it.
Well, I'm very happy to have a publicly funded healthcare system. I think it's a sign of a kind and a gentle society.
Seems decent enough. I haven't had to use it a whole lot, but it seems all right.
Sounds pretty good.
If you need MRIs, it seems to take forever to get one.
They might put you on a waiting list for like 2 or 3 years for like surgeries or whatever.
Well, actually, my mother-in-law actually is waiting for surgery as well. They've told her 2 or 3 different times that she would be having surgery, and it's just not working out.
I have an aunt who's been waiting for a knee replacement, and it's been a couple of years.
I have a friend of mine. She's old as I am, and she's got a cancer and she's gonna die in a few months. She went to the hospital. She had to have tests, you know.
Right.
But it takes so long because they have so much to do. If she would have been taken at the beginning, she wouldn't die today.
Well, maybe this calls for a little more investigation.
I think in general I'm happy with the healthcare system. Stepping on glass and it being like that continually, to be in pain constantly is a terrible thing. It's been 2 years already.
As far as you know, it could be
another year?
Another year more?
Yeah. I think it's a sad thing though that you have to wait 2 years.
How do you feel with that?
There's absolutely nothing that I can do about it. Don't fret about it.
That's the way it is, so that's the way it is.
Yeah, I can't change that. Is it not a long wait in the States?
The wait in the States is 0.
Oh my goodness, no, that's crazy. Any specialized
Pam and Cliff Jansen met ice dancing. To look at them, you'd never guess the orthopedic nightmares they've lived through. It all started with Cliff's neck.
She had to deal with my being set up to go in for a surgery where they were going to put me out, break my neck, put it back together. And so she had to prepare for this how many times?
3 times. He was the top spine surgeon, and when I phoned, they said, I get 3 days next month, that's all I have. And they're already filled with urgent people.
They essentially told me to be absolutely careful in everything I did, because if I fell, I might never get up again.
Cliff's neck surgery was canceled twice, and he lived in limbo for 4 months before being treated. Imagine how the Jansens felt when they were both referred to a surgeon for their arthritic hips, and this happened.
The tape-recorded message essentially starts out saying, this is to inform you that
as of today, it's a 2-year wait list to see me for the first initial consultation.
we had to take out a second mortgage on the house. And we weren't too thrilled about it, but we were concentrating mainly on the pain.
Less than 7 weeks later, they both had surgery in Belgium.
It was a no-brainer. Merely the cost of buying, a mid-range car to get 2 hips. You just go, you get it done, and you get on with your life. We were somewhat of a novelty, being, his and hers hip replacements. We shared a room, husband and wife. It was kind of interesting.
Did they monogram towels for you?
They did not.
Waiting for health care has become a Canadian national pastime. Canadians wait for MRIs, joint replacements, cancer treatment, and heart surgery. Some even go blind waiting for cataract surgery.
I don't understand my world anymore. The cataracts, that's a pretty simple that's why that one is so silly. It takes about 25 minutes in the hospital. I know headaches. I couldn't concentrate. I was becoming less of who I wanted to be. I was having trouble with the yellow and green lights, and especially the lights that went white and said you could walk or couldn't walk, and I was having real trouble with that. You walk slower, you look older. You're not doing what you want to do. You couldn't do anything that your eyes were involved with like you used to be able to do. I just know life wasn't as good. I didn't do marriage well. It's really hard to be sick alone.
No question about it.
Jesus, just somebody to make you soup, it's so cool.
I don't get high at all. Mine, I have no ability to think straight. It's horrible. I have no self-esteem. I'm just so mad and frustrated. The cartilage in my knee gave out. Well, they showed me that the cartilage in the joint was no longer there. You could actually see it bone on bone. It was just very painful. I would need knee surgery, a complete joint replacement. said, well, we'll put you on the waiting list. And I said, well, how long is the waiting list? She says, 12 to 18 months. And I said, what? Broke down crying, thinking I'm not going to be able to tolerate this for more than a week. That was when the nightmare began. We started on the Tylenol 3s, progressed to the Percocet. Then she prescribed the OxyContin, and the doses gradually got bigger and bigger and bigger, and I told her I felt I was addicted or becoming addicted. And she says, well, you most likely will become addicted, but we'll deal with that when the time comes. I thought, now the surgery's done, it's all going to get better. It didn't. They told me that it was a 6-month waiting list to get in.
What's the first thing you're going to do when you're able to say, I'm not a drug addict anymore?
I'm going to take a vacation and get some sleep and try and stay healthy.
Rick Baker, a Vancouver businessman, helps Canadians on long waiting lists get treatment across the border in the United States.
Somebody said the way to prosper in business is to find an aberration. Well, the whole Canadian healthcare system is an aberration. Much as in Soviet Russia, where food was free and everybody had access to it, but they had to stand in a 3-hour line to get a loaf of bread. In Canada, if you want medical care, you have to get in line. So you can drive 2 hours from Toronto to Buffalo, get your care, and get on with your life. Timely Medical Alternatives is, at the end of the day, a relief valve for the Canadian medical system.
There's no relief, however, for the families of patients waiting to learn if they will live or die. Take the case of Jerry Wentworth, a 39-year-old mother of 3 young children.
You know, we were freaking out.
My dad told me that my mom had a stroke or a tumor, something like that. I can't remember exactly what, and I just, like, for the entire rest of the day, I can't explain it really. It was just so down.
We kind of had like a family talk.
You know, we're just freaking out. Like it's not like going in and having a baby. I would have thousands of babies.
I just thought it was like cancer, and like cancer in the brain, that's not a good thing.
My mom and dad were crying, and us were like saying, what's happening?
My surgery would be in 2 to 3 weeks. It was going to be pretty quick, and you know, it was a good 2-centimeter sized tumor. And so we waited for almost 8 or 9 weeks, I think it was, and without hearing anything.
Oh, it was horrible. Like at school, I couldn't concentrate on any of my studies. I remember this one time after the second cancellation that same day. I had fitness testing first block in the morning, and I remember that I was doing my push-ups and I just stopped and I started crying and I just went to the washroom and I went to go see my counselor.
Mom forgot me, my sisters, and brother's names at the hospital.
There's a possibility that, you know, you might not survive, something's going to happen. It's just...
I did a lot of stuff to, like after school, to keep my mind off things.
It's an awesome life, you know. I've had a great life if this was the end, you know.
Well, in this province, an elderly person with arthritis would wait up to 2 or 3 years for a hip or knee replacement. A dog could get that same operation in under a week. The The Canadian law as it stands forbids a citizen from either paying for necessary healthcare or obtaining insurance in this country to get that healthcare. It's legal to buy health insurance for your pets in Canada, but illegal to buy health insurance for yourself.
If your cat gets sick, you can go get a CAT scan if you want, but you can't do that for your child. The idea that you should be able to purchase care for a non-human and you can't take care of your own human family, it's absurd.
In search of clinical verification, we visited a veterinary hospital a few miles away. There, we discovered a world where the animals felt right at home. And all the patients, whether lightweight,
3 pounds, 1 ounce.
heavyweight,
Is 15.1.
or anorexic, laid back, or on the run, seemed happy to be there.
Routine standard blood work, x-rays, ultrasound, CT scans, MRIs are also possible as well.
Yes, the facility was first rate, and the staff was loving and supportive. Still, when you're not feeling well, when you're away from home and the ones who love you, it's always stressful and hard to take. But on this very busy Saturday morning, while doctors' offices all over Canada were locked up tight, four-legged patients were at an obvious advantage.
How long did you have to wait to get care for your dog today?
3 minutes.
It's amazing what a little competition will do. The hospitals in Canada are all publicly funded. These are all the hospital listings in the Vancouver Yellow Pages. On the other hand, you can use your own money to pay for your pet's care. These are the Vancouver listings for veterinarians. These vet ads show what competition does. It spawns clear, low prices, discounts and free services, convenient amenities, 7-day work weeks from dawn to midnight, and the holy grail of healthcare: house calls, house calls, house calls. If your cats don't like dogs, there are choices galore. Even birds scared of cats have their own special store. Other than Canada, only Cuba and North Korea forbid their citizens to pay for their own medical care. Assemblywoman Sheila Kuehl is trying to add California to that list. Her bill, expected to pass the Democrat-controlled Assembly later this year, would make it illegal to buy or sell private health insurance. There is only one obstacle in Sheila's path. Californians shouldn't fret, though. If Sheila is successful, at least their pets won't have to wait in line for medical care.
You know, when I talk about my mother to people, sometimes they think she must have been a saint. To me, she was a saint. We were very close. The 3 main arteries going to her heart were all significantly clogged. And she had the opportunity to have a surgery that would save her life and would extend her life, and she would have a quality of life, an enjoyable quality of life. So she was put on the waiting list in approximately 2000. Didn't get a surgery date until a couple of years later. When she had her first surgery date, I went to Winnipeg to be with her for her surgery, and they had canceled it. So they gave her another surgery date. And then they canceled her second surgery date. She trusted her doctors and she trusted the system. She thought she was being taken care of. And I kept saying to her, Mom, are you sure everything's okay? Are you sure that this is normal? Because it's been such a long time. You've been waiting 2 years for a surgery and they're canceling your surgery dates. When I was out there for her first scheduled surgery date, I said to her, Mom, if anything happens to you, because I had a feeling. And something did happen to her. She waited and she waited. And then I got the phone call. That she had collapsed and probably wasn't going to make it. You know, there was a 1% chance approximately that she would have died on the table if she would have had her operation. But because of more emergent patients, she had to wait. So she worked very, very hard and always gave to people. So I was so happy that finally she'd be able to get what's coming to her. That she was ripped off big time.
At last count, 876,000 Canadians were on waiting lists for medical procedures. If things were the same here, we would have well over 8 million Americans waiting for health care. In short, we would be cooked.
Do you think the treatment that you get in Canada is good? The healthcare?
Healthcare, oh God.
Because the rich people are much better than the poor people, so they deserve better healthcare, you know? Because, you know, when you have money, you're good, you're the best. And the poor people, America. America.
What do you say to people who might criticize you for profiting from the misfortune of your fellow citizens?
That's horseshit.
Your sister's, right?
Oh, my goodness.
So you don't mind seeing you messing around?
Everybody in the medical system, every physician, profits from people's medical misfortunes. It's just, that's the way it works.
I smoke marijuana. Okay.
Imagine that.
Yeah.